Hello, my name is Anastasia and today I will be speaking with you today on an occupational health issue. And the issue that I'll be addressing is the effectiveness of hearing evaluation programs in industrial workplaces. The approach that I took to address this problem is a literature review of this topic. There's much knowledge that I have gained from undertaking this project. Today I will, however, be only addressing 4 key things that I learned relative to this problem. All the resources that will be utilized in this presentation can be found at the end of this video. First thing that I learned relative to this problem is how hearing conservation programs have evolved with the guidance and standards of federal regulations. Knowing who the Occupational Health and Safety Administration is, also known as OSHA, is in knowing how their contributions over the past 30 years have really been eye-opening. Thinking about industrial workplaces, they've been around for quite some time, for years. Many workers would just go to work and not really know that they were being exposed to occupational hazards. So it was really important to figure out on how to protect workers from these hazards, more specifically noise exposures. So in 1983, OSHA decided that it would be regulated that if employers have workers that are exposed to 85 decibels or greater for an 8-hour time weighted average, they will be implemented in a hearing conservation program. Research of Rabinowitz, Gluspa, Kirsch, Collins, Slade, and Dixon Ernst in 2011 illustrated data that was gathered over a 20-year period in how in industrial workplaces, some places had hearing conservation programs, some did not, and just how these regulations of OSHA really drove changes in the workplace for the better. And in the process of gathering research for this problem, where there is an effective hearing conservation program, there's effective worker health and safety that contributes to fewer cases of noise-induced hearing loss. The second thing that I learned from this project is that the success of an effective hearing evaluation program is built from a well-established occupational health and safety program. How will a worker know what type of exposures that they need to protect themselves from if they are not trained and educated on what those exposures are in the workplace and what the best practices are to protect against them? Again, more specifically, noise exposures, because noise hazards is one of the most prevalent exposures in industrial workplaces, so it is in the best interest of the workplace to ensure that they're providing the most reliable information to these workers to make sure that they know how well to protect themselves, and especially how to prevent noise-induced hearing loss. Research of Burke, Sarpy, Smith-Crowe, Chan-Serafin, Salvador, and Nilsson in 2006 illustrated that industrial workers are exposed to noise-induced hearing loss and how it is important to provide effective training in these programs to make sure that they're covering everything that a worker needs to know, and how this can contribute to an overall positive result of effectiveness of a hearing evaluation program in industrial workplaces. The other thing that I learned from this project is how noise-induced hearing loss plays a factor in effective hearing evaluation programs. The rationale for addressing noise-induced hearing loss in industrial workplaces is that hearing is an important factor when dealing with safety within the occupational workplace, for without effective hearing, it makes it very difficult for the workers to communicate with one another, let alone communicate emergency procedures or anything of importance that a member needs to hear. And it also and noise exposure and occupational hazard that continues to contribute to hearing loss at a worldwide level. Research of Fredrickson, Rasmussen, Hansen, Stockholm, Grinder, Hansen, Christensen, Vestergaard, Bond, and Kolsub in 2007 really delivers that it really illustrates it remains the most frequent cause of preventable central hearing loss. So the primary concern is that not just the personal safety of the member, but for the safety of others around them as well. It's very important. If you don't have effective hearing, it makes it very difficult to communicate and hear what's important. And not only that, but as well as the prevalence of members wearing hearing protection against the prevalence of members not wearing hearing protection and what needs to be done about that. So the fourth thing that I learned from this project is of the contributing factors to actual noise-induced hearing loss. As mentioned before, it is preventable. However, there are also contributing factors. So research of Pettersson, Burström, and Nilsson in 2004 illustrate the relationship between handheld vibrating machines and noise-induced hearing loss in both men and women, and the frequency of repetitive vibration exposure and how that can cause hearing loss over time. That was really interesting to know that is even a factor. And another contributing factor that I had no idea about was contributing factor of smoking. So this actually contributes to vascular changes, and those vascular changes then affects your hearing in what is known as cochlear hypoxia. And in research of Zhao in 2013, there were studies that were conducted on industrial workers versus smokers versus non-smokers, and they found out that smokers had poorer hearing thresholds than the non-smokers. So I hope that you enjoyed this presentation, and I hope that I provided with you some interesting knowledge if you did not already know the importance of this occupational health issue. I hope that this provided you with an understanding of what type of occupational health issue and how it relates to today's force and what we can do to improve on it. Thank you for your time. Take care and best of luck on future endeavors.